Hi everyone, I'm Dr. Suguna. Now we'll be learning the nerve supply of the lower limb. Okay, so it arises mainly from the lumbosacral enlargement with the root values L1 to S3. So here is a lumbosacral enlargement, right? So the first nerve is the iliohypogastric nerve with the root value L1 arising from here. Then we have the ilioinguinal nerve again with root value L1. Then the genitofemoral nerve arising with the root values L1 and 2. Then obturator nerve L234 from the ventral division, femoral nerve L234 from the dorsal division. So here is the obturator nerve and the femoral nerves. So the L234 are from the anterior primary rami. Now the important nerve here is the sciatic nerve. It has the root values L4, 5, S1, 2 and 3. It passes from the pelvis through the greater sciatic notch. So you can see it is passing from the pelvis into the greater sciatic notch and enters the gluteal region where it continues to supply the posterior aspect of the thigh. So here it gives rise to two important branches. These are the tibial nerve and the common fibular nerve. So the tibial nerve runs with the tibia and the common fibular nerve runs with the fibula. It gives rise to superficial and deep branches. So this nerve is also known as the common peroneal nerve. Now, the lumbosacral plexus, the superior gluteal nerve, has the root value L4, 5 and S1. So here is the superior gluteal nerve. Then the inferior gluteal nerve, the root values are L5, S1 and S2. Supplies the gluteus maximus muscle and the pudendal nerve with the root values S2, 3 and 4. The posterior cutaneous nerve of thigh, it has the root value of S1, 2 and 3. So here is the posterior cutaneous nerve and here is the pudendal nerve. Now let us look at the dermatomal supply. So the little toe has the dermatome of S1, the greater toe L5, lower limb L1 and S1, and the inguinal region L1. S1 supplies the little toe lateral margin of the foot. The L5 also supplies the dorsum of the first web space, that is the greater toe, and the deep saphenous nerve supplies in this dermatome. Then the L4 dermatome is along the medial malleolus, that is the medial margin of the foot, and here the saphenous nerve supplies. Now, posterior aspect of the lower limb, L5 dermatome is for the greater toe and it is supplied by the medial plantar nerve, which is nothing but a branch of the tibial nerve. Then S1 by that is the dermatome of little toe and the lateral margin of the foot supplied by the lateral plantar nerve. Then S2 is for the calf and thigh. S2, 3 and 4 are for the pelvis and the perineum. Now we have discussed how the limb rotation varies with respect to the upper limb and the lower limb in our upper limb classes. We'll quickly revise. In the embryonic life, the upper limb rotates 90 degrees laterally and the lower limb rotates medially. So because of this, the thumb becomes lateral in position. Okay. So the flexor compartment comes to lie anteriorly. This is just opposite to the lower limb, where the lower limb rotates 90 degrees medially. So the greater toe is located medially. Now look at your greater toe. It is on the medial side, but your thumb in the anatomical position, it's on the lateral side, right? So that is why the flexor compartment for the lower limb is located posteriorly, whereas for the upper limb it is located anteriorly. Okay, so you can clearly see this is the flexion movement and the muscles are posterior, and the extension movement, the muscles are located anteriorly. Okay, now the myotomes and their actions, let's quickly revise. For the hip flexion, the important muscle is iliopsoas with nerve roots L2 and 3, and the plexus from where they arise, it is the femoral or the lumbar plexus, right? Then the knee extension is mainly by the quadriceps with the nerve root L4, and the nerve is the femoral nerve, and the reflex that is elicited over here, we all are familiar with the patellar reflex. Then the ankle dorsiflexion, the muscle is tibialis anterior, the nerve root is L5 and the nerve is the deep peroneal nerve. Then the ankle plantar flexion is brought about by gastrocnemius and the soleus muscle with nerve root values S1, and the nerve supply here is the tibial nerve, and here we have the Tendo Achilles reflex, right? You hit with the knee hammer on the Achilles tendon and you see a plantar flexion at the ankle. Then the toe plantar flexion is brought about by the flexor hallucis longus. The nerve root is S2 and the nerve supply is the tibial nerve. Okay. Thank you.